Hi, welcome to the Implantcast VR training session. This is an example how can we use VR headsets. In this case, we are using the Meta Quest 2. So here we have some examples of files that we can use, custom files. So we have here the position of the patient. We are showing the delta pectoralis approach. We can discuss where is the position of the patient in a big chair position. If we're going to do which approach, we can teach about anatomy, and we can have custom cases. So this is a patient from a CT that has already a implant cast arthroplasty. So we are showing here this patient has a anterior defect because this is a instability case. We can show the humerus, the defects, we can show the osteophyte. So all the students are inside this room in 3D, and we are discussing what we are going to do with this custom case. So this is the scenario that we choose to teach how to do the technique. So here we have some implants. This is only the implants, but we could have here all the instruments needed in 3D to perform the surgery in this virtual table. So we're going to choose the step number 1, which is the humerus. So now we are going to teach where we are going to do the humeral osteotomy and discuss the location, the retroversion. So here I'm teaching where I'm going to do the osteotomy. Now we are discussing where we are going to put the retroversion of the humerus for this osteotomy. So this would be step number 1 for the surgical technique. Now we are going to go to the step number 2, where we already have the humeral osteotomy. Here we are, and we are going to choose the stem. In this case, this is not an Implantcast stem because I don't have it in my portfolio. So we're going to use a regular stem, and we discuss here the technique and also the stem. We could be doing the technique itself, choosing the size of the stem, how to put the insert guide, but in this case we're going to choose, going to show where the stem. So we're going to discuss also the retroversion if we want to put the stem more retroverted. If we could choose here different stem sizes. We could choose different locations. Now the step number 3, we have already done the stem. Now we're going to prepare the glenoid. We could have the guide. In this case, we're going to discuss which implant we're going to use, the Agilon number 3, the Agilon number 2, with a long or a short peg. And now we can discuss also if we're going to go for the Mutter's implant. In this case, we choose the Agilon, and we can discuss with the students the location. Now we are going to change the transparency of the glenoid, as you can see here, so everyone can see where the central peg is positioned. We can see if it's located in the correct position on retroversion. So now we're going to change the version, sorry. Now we're going to adjust. So we're performing a planning, a 3D planning, and discussing this 3D planning in VR. So we have multiple possibilities of discussion. We can even do the complete planning for this surgery, and we can do the virtual surgery itself as we want. We could have a drilling guide, we could have a drill to do some part of the drilling, and we can have other scenarios to choose and test for every patient case. Now, thank you very much for the video.